Hi everyone, my name is Taya Munson. I'm currently an ultrasound student at UMI doing my externship at Lifeline. I first introduce myself to the patient, ask them to come into the room, verify their last name, and have them lie supine on the table. Now I'm going to start my protocol. I first put gel on my curvilinear probe. Then I set up their pre-programmed protocol, and I start my protocol off scanning prox to distal in sag and transverse. Now to show you the protocol for Lifeline, first we start off with a dual image in sag of prox to mid, then mid to distal, and we measure in prox and in distal. Then we do an image in trans of the prox and we measure that 2 ways. Then we do a photo in trans mid, do 2 measurements. Then the last photo is a dual image in trans of the distal, you measure it, and then you do a photo of the iliacs and you don't measure that photo. A couple ways to optimize the image is by adjusting the gain and adjusting the depth. Also wiggling the transducer to get the best image possible. Once I've finished the protocol, I wipe off the transducer and I spray it, then wipe it again. Then I make sure to wipe up the patient and make sure when they get up that they aren't lightheaded and let them off for the day. Or if they haven't finished all their tests, let them go finish the rest of their tests with the other employees.